everyone. Today I want to teach you a little bit knowledge about asthma, which is a very common condition. Now, asthma is a problem that causes your airway to become inflamed. So it is the inflammation of your airway. Now, what actually composes your airway? Your airway is made of your trachea and then bronchioles and then bronchioles and then going to your lung to supply oxygen. Now, when you breathe in the air, now the air needs to go through the trachea and then go to your bronchioles and the bronchioles and then reach your lung. So this is how your airway is made of. Now when you have asthma, actually asthma is more related to genetic factor. And if you have one or more than one family members who have asthma, then you have high possibility of developing the same condition. Now, what causes asthma? So what causes your airway to become inflamed? What is inflammation? Now we know that every person is differently designed. Our body actually is very unique, and your body is different with others. Now, some people, when they breathe in the air, when they breathe in certain substances in the air, now their body actually triggers really strong reaction. Now their immunity is very sensitive to certain type of irritants that they breathe in through the air. For example, some people could be allergic to dust. Some people could be allergic to pollen or smoke, or certain things that when they breathe in, their immunity could become overactive and try very hard to get rid of the irritants that they breathe in. Now, when the immunity start to fight against the irritants, now their airways become severely active. So the airways become severely inflamed, which means that the airway will become swollen, narrowed, and secrete a lot of mucus, and patient will cough, and also the airway will become red and make patients feel really difficulty with breathing. So the most important symptom is short of breath when patients have asthma attack. So for people who have chronic asthma, the symptoms not that serious, but people who have like asthma attack, actually it is life-threatening and could cause serious consequences. So remember, asthma is actually an allergic reaction when your airway is allergic to something that you breathe in. Okay, and whenever you breathe in this certain thing, now your immunities become really active and trying really hard to get rid of. But when the immunity is really active, now they triggers your airway to become very inflamed and swollen and short of breath and produce a lot of mucus. So patient will feel really struggling with breathing and cough a lot, and they could not handle the condition. And if we don't treat it properly, patient could die from it. So this is asthma. So chronic asthma could be chronic and doesn't cause severe breathing issues. But when people have acute asthma attack, and it could be very dangerous. So this is asthma. Now, how do you treat asthma? So we normally have two kind of medications that you can take to relieve asthma symptoms. Now, two kind of medication. Now, one medication we call it bronchodilator. It is like inhaler that you actually inhale through your mouth into your airway. Now, this medicine, bronchodilator, now this medicine can work on your airway and make your airway become widened. So can open your airway, make it wider, so the air could flow to your airway more easily. So this is called bronchodilator. Remember, it is like a puffer that you breathe in, and you breathe in those puffer, okay, into your lungs to open your airway. Now, another type of medicine that you can take is the cortical steroid, or the puffer, the inhaler that also you inhale into your airway, but it works differently. So it actually contains the cortical steroid medicines, which could reduce the inflammatory responses, which could reduce inflammation. Now, for example, one inhaler is called the is called the Symbicort. Now, Symbicort actually can reduce the inflammation because it contains the cortical steroid. Now, this medicine actually can reduce your immunities. Okay, reduce your immunities response, make your immunity settle down a little bit, so the inflammation symptoms will also be relieved. Okay, so people will have less short of breath, and the airway will become widened and less swollen, and also make the airway produce less mucus to treat the problem. So remember, okay, asthma condition is a allergic reaction, because your airway become allergic to something that you breathe in through the air. Okay, whenever you breathe in that thing, now your immunity start to become oversensitive and act in a very aggressive way. Okay, so your immunity works overactive. So make your airway to have those inflammatory responses and become swollen and produce a lot of mucus and make you feel really struggling with breathing. Okay, so this is how asthma caused. Now remember, two medications that we can take to treat asthma. One is Bronchodilator. You inhale this medicine, it can dilate your airway. Another one is called the Cortical Steroid. Okay, it also made in the added into the inhaler. So when you breathe into this inhaler, it contains the cortical steroid. This medicine could reduce your immunity response and at the same time reduce your inflammation symptoms, make your airway become less swollen, make you produce less mucus, and ease your breathing as well. Thank you very much. Hope you can have a little bit more understanding about asthma.